episode of the NEI podcast, we are talking about something very timely and important. We're discussing the aftermath of the COVID-19 pandemic, and for so many people, what is still ongoing in terms of how does this impact pediatric anxiety? And I have here with me today two experts in pediatric psychiatry. I have with me Dr. Manpreet Singh and Dr. Jeffrey Strawn. Welcome to our show.
Thank you.
Thank you, Sabrina.
My first question for you is, what are the current issues that many children and parents are facing with children returning to school in person after over a year of virtual or hybrid learning?
Sabrina, it's a great question to kick off our conversation. Starting school is a major milestone for kids and for parents, as it is. Lots of things happen in that transition, and many kids are going to a new school for the first time. Maybe they're starting middle school or transitioning to high school or starting school or preschool or kindergarten. And those big transitions, even in non-pandemic times, are major. And with the pandemic, we just might see an amplification of the stress that might be associated with those transitions. Kids might have concerns about starting school, but they also might have concerns specific to the pandemic. Like, for example, in the state of California, where I am, there's a mandate that California students have to wear masks while indoors. Kids who are more anxious may ask a lot of questions. How am I going to keep my mask on all day? What if I want to take it off? What are the rules around that? They may have increased fear of getting sick as well. For some kids, it'll be the first time they've been in close proximity to groups of people in a very long time, which may bring up concerns about social interactions. Like for kids in middle and high school, the dynamics of interacting with other kids are really important during that developmental stage. They've just had a year and a half of just navigating their social lives digitally, and now they have to re-navigate and manage those social dynamics in person. So those social interactions might feel more emotionally challenging. And we have to also keep in mind that not all kids are the same. So with digital learning, some kids really struggled to stay engaged, motivated, grasp the material, and remain connected with friends and teachers. But there were other kids, some maybe who were shy or had difficulties in large group settings, who actually thrived. So for the more introverted kids, if they've been more in a comfort zone at home, going back to large groups may be a more difficult transition.
Why is separation anxiety so prevalent during this time, and what can families do to help with this situation?
Sabrina, I think that's a really good question. And when we're talking about separation anxiety, I think it's important to remember that all anxiety, particularly in kids, has a function. And I think sometimes we don't think about it in terms of that functional role. So I think it's very helpful to look at it through that lens. Mm-hmm. Now, thinking in terms of that function, separation anxiety allows us to maintain closeness, safety, and particularly relevant for kids, comfort. So it's normal for a child in pain or a child who's been hurt or is sad or anxious to want to be close to their parent or their caregiver. In fact, I'm reminded of this personally when my normally well-adjusted 7-year-old daughter wanted to lay with me in her bed last night after reading a story. So she just had a tooth extracted and was in a little bit of pain. And in her words, although she didn't understand why, she said, "I just want you to lay with me, Dad." Now, this process is pretty normal. Although with the stress and disruption caused by the pandemic, it's more and more common. Mm-hmm. Now, that being said, when we're talking about separation anxiety that's pathological or separation anxiety disorder, this is something that is very different from normal separation anxiety. This is an actual disorder that affects between 3 and 8% of children.
Right.
Now, another thing that I think is worth mentioning in terms of separation anxiety, although I know we're focusing on school and kids, is that separation anxiety can actually happen in adolescence and it can happen even in adulthood. Now, separation anxiety was once considered to pretty infrequently or very rarely persist into adulthood. But one of the things that we now know is that separation anxiety can continue into adulthood and in some cases may even emerge during adulthood.
Mm-hmm.
Now, this condition, separation anxiety disorder in adults, is certainly understudied. But I think importantly, some practitioners have probably considered separation anxiety just as a temperament type or a personality feature, a symptom of specific personality disorder. In other words, dependence or fears of abandonment. But it's really important to recognize that separation anxiety disorder can exist as a separate, independent disorder, and that it affects both kids as well as adults and really has a number of clinical implications.
Thank you so much for sharing that with us. I'd like to touch on something that Dr. Singh started to share with us, and that is, how does age or the developmental stage that the child is in factor into pediatric anxiety about things like returning to school? And how do children differ in terms of coping strategies that could be related to those developmental stages?
I think Dr. Singh raised a really important point in that anxiety and adjustment at different phases looks very different. And certainly as child and adolescent psychiatrists, we're used to thinking about development in normal, if you will, developmental tasks. But what's very important is to think about those processes that underlie the ability of an individual to accomplish those developmental tasks. And often those are features of cognitive development, emotional development, and self-regulation, things that I know Dr. Singh studies in her research work.
That's a great point, and thank you for the shout out, Dr. Strawn. The work of trying to understand and contextualize age, both from the perspective of identifying symptoms, but also knowing what to do, is critical to working with children and families. So we might wonder what signs might alert parents to their kids feeling anxious about returning to school, and that really does depend on the age of the kid. Among our very young children, parents might see increased tearfulness about going to preschool or daycare, more clinging behavior or regression in milestones, like a kid who was previously potty trained no longer can do that. With school-age children, parents might see maybe a little bit of resistance to going to school, maybe some oppositional behavior and somatic complaints like belly aches or headaches. That's really tricky to navigate because schools now have strict guidelines about not coming to school sick. So how do you tease apart whether a physical symptom, a somatic complaint, is one that's originating from a behavior versus a different organ system? For teens, there may also be school refusal and withdrawal, like staying isolated in the room, or maybe you'll notice more irritability and moodiness in the adolescent. Risk-taking behaviors like substance abuse or other risky or impulsive behaviors might also increase. After being in the homes for so long, one can imagine the risk-taking behaviors as a reaction to the restrictions that we've had for so long. And parents can expect some distress and worry during the first few weeks of school, true of any transition, especially now when kids are being asked to do so many new things all at once. Get your school supplies together, have a mask ready, have a hand sanitizer, have all of these other materials in addition to what you already need to set up to get ready for school. And that can deplete energy levels and emotional reserves for kids. But if there's a major change from a kid's behavior at baseline that doesn't sort of go away after a couple of weeks, for example, if an adolescent who's withdrawing more and more and refusing to engage in typical activities, or a kid who is younger is progressively more stressed, those are red flags, and those are ones to pay attention to. And parents might want to consider seeking help at that point.
And that actually leads me to my next question, which is what unique challenges are teenagers and adolescents facing when it comes to transitioning from distance learning to being in person at school again?
So that's a really important question. In terms of many teens, the disruption that's been brought on by the pandemic has not only affected academic development, but it's also in many ways disrupted the normalcy of the school routine. And I want to spend a few moments talking about that school routine because routines are very, very important developmentally and really in many ways throughout life. They provide structure and they oftentimes have a very close, intimate relationship with anxiety, both in terms of improving anxiety and in some cases when there are changes, precipitating anxiety. Now, the school routine really for all ages can be viewed as an organizing experience. And as I mentioned, there's a pretty close relationship between organization, structure, and anxiety. Now, another challenge related to this transition back to in-person instruction relates to uncertainty and something we call in the anxiety world intolerance of uncertainty. Now, for many, especially those who are familiar with worry and anxiety, uncertainty reverberates with our own anxious thoughts. When we're confronted with uncertainty, in other words, what will the new school routine look like? Will I be wearing a mask? Will others be wearing a mask? How will this affect a particular class? Our what-if thoughts and negative expectations may flood our minds. Now, in dealing with this uncertainty, it's important for us and for us to help our children and adolescents that we're working with remember that while we can't predict the future or know all of the details about that school transition, we can generate positive feelings about the possibilities. Mm-hmm. So we need to really remember and anchor ourselves with our past successes and also preemptively address the stress, particularly that's related to uncertainty. And there are a number of approaches that we can use here in terms of mindfulness as well as other relaxation techniques.
That's excellent. What challenges do parents experience with this transition of children returning to school right now? And what are some ways that they can better cope or self-regulate so that they can become more present for their child?
Sabrina, I think you've hit the nail on the head in terms of what factors might contribute centrally to a child's anxiety. Parents are really the biggest role models for children. If kids see parents really anxious about something, they're going to feed off of that. And parents need to be mindful of their own emotions so that they can regulate their own emotions and be present for their child. Take care of yourself before you take care of others. And we want to be steady sources of support for our children. It's also fine to say that we feel worried or we don't know the answer. Mm-hmm. It labels emotions and it shows that it's okay to feel those things. It's normalizing. Mm-hmm. The problem is when our worries get so big, when we're no longer calm or we're saying and doing things that we don't want to model for our children, it ends up creating a loop in and of itself. Right, so I say this with deep humility, and perhaps I'm saying it to myself as much as I am to you, that it's essential to find moments of self-care and self-compassion. Because taking even just a couple of deep breaths in the moment, taking a bathroom break, if you can get one, getting a drink of water or doing other things that just creates somewhat of a transition or a break for yourself as a parent can be life-saving. And it's a moment to regulate a parent's feelings that can be very helpful. And thinking back to what worked for you before the pandemic and trying to get even small inklings of that back, like 5 minutes a day of movement or exercise, is just as regulating and self-organizing as what Dr. Strawn described before for children in terms of establishing and maintaining routines. It's not only important for children, but it's also important for the parents to have strategies for self-care. And we can also invite our kids into healthy coping activities with us. So parents can be encouraged to invite school-age children or older children. I'm feeling pretty stressed about this. And for me, I'm going to walk to clear my head. Maybe let's go for a walk together. Would you like to come with me? I can't tell you how many times that it was a real realignment for my children and I in the early days of the pandemic. Parents with young kids can blow bubbles together. Small kids enjoy that. And you can talk about how big breaths for bubbles helps everyone feel better. And if they need more help, parents can seek resources from the teachers and support staff at the kids' schools, but also from pediatricians and from other mental health resources. Finally, Sabrina, I would just add, Pooja Lakshman did a really great job on an article in the New York Times about last week, I think, about 4 ways parents can calm their back to school fears, because they do it does help to calm the parents so that that calm can spread to the kids. And the 4 strategies she suggested, I urge you to read the article, but number 1, anticipate your fears. Number 2, practice psychological flexibility. Number 3, acknowledge hard truths. And 4, find meaning in trauma. So if there's situations where the anxiety has really become much, much more serious, finding meaning in the impact of that can be very helpful and perhaps a salve that we could all benefit from to varying degrees.
And we can leave a link to that article in the show notes.
Yep.
Thank you for sharing that with us. My next question is, how does the family structure, parenting style, and role modeling play a role in pediatric anxiety?
So as Dr. Singh mentioned here, that parents really play a central role in supporting children and helping children deal with anxiety. Now, Dr. Singh also mentioned something very important, which is the route from parents to anxiety. It's not a one-way street. It's pretty clear that anxious children have a substantial impact on their parents' behavior and vice versa. Now, children with anxiety tend to bring a vulnerability to many interactions, if not almost all interactions with their parents, that predisposes them to a pattern, if you will, of anxious dysregulation. But it's also important to remember that the parents come to these interactions with certain behaviors that may either accelerate or mitigate anxiety. Now, we know from the research that's been done really over the last 60 or 70 years that there are some parenting behaviors that are associated with anxiety in children and adolescents. And these include things like parental over-control, overprotection, criticism, and rejection. Really, though, we're left with this chicken and egg problem. So it's important to consider how parents with differing styles interact with a child with significant anxiety or even an anxiety disorder. And in that sense, we can think about this in terms of 2 dimensions. Now, these include flexibility or control as a continuum that ranges from rigid to chaotic, as well as cohesion. So thinking about this as an example with regard to the current pandemic situation, when we have, for example, the chaotic and enmeshed parenting style, this combination leads to a more reactive interpersonal processes on the part of the child that really accelerate more anxious dysregulation. Now, the parents may more readily attend to their child's expressions of anxiety and also may be more likely to facilitate avoidance. And this is something that's particularly relevant as kids return to school. Also, the parents may be anxious and dysregulated themselves, as Dr. Singh alluded to, and thus they may model anxiety or catastrophic thinking. Now, in the end, enmeshment, escalating dependency, social isolation, all things we've seen increase with COVID, as well as other factors like a chaotic home structure and relationships, can perpetuate, or in some cases, even create dysregulated behavior and anxiety.
How does communication with the child and allowing them to express their feelings and validating them help? How can adults initiate healthy conversations about emotions that surround anxiety?
This is a great question. I think stimulates all of us to wonder and be curious about how children express emotions. So much of that is through modeling. But what parents can do is show an interest and be supportive and encouraging. Mm-hmm. It's very important for kids to hear about what to expect, like activities, schedules, toys, other kids, routines. Those expectations are a very important part of that communication. Taking your kids to school to get used to the layout, maybe look at the map together, introduce your child to the teacher. Most schools have some form of a meet the teacher in advance of the school start, letting the kids know it's normal to feel nervous or worried about being away from home, and suggest taking a familiar object or a family picture to school, getting on the bus with a favorite playmate, or carpooling with a friend if it's safe to do so, or a potted friend. Identifying a buddy at school can also help decrease the fears about being alone or in a new setting. And it's also very useful in the preparation phase to get ready for school. Do a stress-free ritual, one that's fun, lays out all the notebooks and the clothes the night before. Have the kids help with school preparations, like making the lunch the night before, or picking out their outfits to reduce the stress for everybody. But, if a kid remains anxious, there are other steps that parents can take. When our kids are upset, our natural instinct is to remove that distress that they're experiencing. But we ought to try to not jump straight to solving problems for our children. The first step is really to listen and create some space for kids to voice their concerns. Acknowledge the feelings that they're having, even if you don't agree with them, even if they sound irrational. The child should feel that they are being heard, and it's okay to feel what they're feeling, and that they have a space to talk about it with someone they trust. Once the parents have a better sense of what's going on, they can work then collaboratively with the kid to figure out a plan. They can ask, what does a child feel like when they're capable of doing? What kind of things do they feel confident about? What can mom and dad do to help? Who else could help? Is there a friend or a sibling or another family member? For if a kid refuses to go to school, parents can say, how can we make it feel easier? This is a very important question, because it also communicates to the child that ultimately it's their job to go to school. I tell this to my children and families all the time. What's your job? Your job is to go to school. And if we create small opportunities for getting through difficult situations and coping with worries, kids will build the confidence that they need and the independence to just feel more in control and less afraid. And it's important to remember that children are indeed quite resilient and adaptive. So whenever any transition occurs, they'll eventually find their groove. And so finding examples of where they've actually mastered something that they were anxious about, it can often serve as good reminders. And it's okay to ask for help. The teachers at school know and understand that these are all transitions, and very important and big transitions for kids. And they're also gearing up to help. So the more you imagine that it takes a village and lean into the village, I think the better off many children are.
That was such a great answer. Thank you so much for sharing all of that with us. So Dr. Strawn touched on this a little bit earlier in the interview, but how does routine play a role in reducing pediatric anxiety about returning to school, and how can parents help with establishing routines during this transition? You shared a little bit with us as well, Dr. Singh. Is there anything else that either of you would like to add about this?
I agree, Sabrina. Dr. Strawn gave some great suggestions on the importance of establishing routines and how one can do that. Some practical tips parents can start talking about going back even well before. And in my patient populations, I start the conversation about transitions to school about a month before school actually starts. I ask when school starts earlier in the summer so I can anticipate when I need to have that conversation. Because
That's
what
great.
that initiation does is it helps kids remember that they might like to begin transitioning to their school schedule for sleeping, because summer schedule for sleeping is often very different. And just even getting a routine around sleep regulation can be very helpful. And 2 to 3 weeks ahead of the start of school can really facilitate a smooth transition. So talking about going back, establishing school routines like sleep schedules, listening to what's on the kids' minds, engaging the kids on the fun components of returning to school. What are you looking forward to? Picking out school supplies or a new t-shirt or something that they can get excited about. They can also walk or drive by the school or visit the playground to build the anticipation. It might also be helpful to start practicing saying goodbye and leaving the house for the younger kids, encouraging independent play and helping kids adjust to being away from their parents. And as I alluded to before, if bedtimes have drifted late during the summer vacation, then parents can begin to shift the family schedule during the week or 2 or 3 before school starts so that you can get back into the habit of going to bed and waking up on a schedule, on a routine. And it can also reestablish other pre-pandemic routines that worked well for the family. For example, in my household, we tried to avoid screen exposure during the week while the kids are at school. And it's viewed as a fun activity, a family activity, like family movie night on Friday night, partly as a reward, but it also builds anticipation and reduces that screen time. And those kinds of strategies can really facilitate not just routine building, but it can reduce the worries because it creates a regular expectation for kids that can also help lay their fears.
That's excellent. Thank you so much. And that turns me to my last question, which is, what are the most critical components that need to be addressed right now regarding social well-being when it comes to children returning to school? And what can pediatric clinicians do to best support children and their parents during this time?
Sabrina, as you asked this question, I find my mind really going in 2 different directions. In one direction, I'm going back to my undergrad days, learning about Maslow's hierarchy of needs. But I'm also thinking about more contemporary literature around trauma-informed care. Thinking about Maslow, I'm reminded that he thought about our needs in terms of basic needs. So those were things like food, water, warmth, but also safety needs, security, safety, etc.
Right.
Now, of course, everyone remembers that these were followed by things like belongingness and esteem, which he called psychological needs. What I think is really important as we look at this question is that some systems in recent days and weeks have focused on higher needs without first providing that environment in which the safety needs are met. And I think this is a place where we as clinicians, as public health advocates, and advocates for children and adolescents really need to work with partners.
Right.
These needs, the safety needs, if you will, are critical to returning to school. And a discussion of social well-being really can't be had until we've addressed more of the safety concerns, that we've addressed things that affect transmission, that prevention strategies are in place, and very importantly, that students, as well as those charged with their safety, feel comfortable with these strategies.
Points, Dr.
Now, thank you. But I think moving back to your original question, Sabrina, as we think about the social needs, I think that's probably a nice opportunity to think about trauma-informed care and borrowing some of this approach from the National Center for Traumatic Stress and a number of colleagues. But what I think is very important is that when we look at trauma-informed care, again, it emphasizes safety as the first step.
Mm-hmm. Mm-hmm.
Now, having established safety, we should probably do things like increasing peer support, also increasing collaboration and mutuality, really creating that space in which people are comfortable to talk about anxieties, difficulties with adjustments, differences in expectations, uncertainty, some of those things that we've already talked about earlier in the podcast.
Mm-hmm.
The next step would really be in terms of facilitating more empowerment and also choice. And doing all of this as if it's some small task, we certainly need to make sure that we're tending to cultural, historical, gender, racial, and ethnic issues.
Right, right. Wow, that was an excellent answer to end on. And Dr. Singh, is there anything you would like to add?
Dr. Strawn, I thought that was a great summary. And your point about looking for ways for us to understand how anxiety plays out in different populations is so important. And I guess my final thought on that would simply be that we have some work to do to understand how anxiety and stress manifest in different subpopulations. And I'm looking forward to learning more about that, both in the pandemic and beyond. We have our work cut out for us, and I'm looking forward to rolling up our sleeves and doing this work together.
Absolutely. Thank you so much for being part of our show. Thank you so much for joining us for this episode. Make sure to subscribe and tell your friends and colleagues about the podcast. Also, we love to hear from our listeners. Please review the NEI podcast and share a topic that you'd love to learn more about.